Thank you, everybody, for coming to the Awaken Thriving podcast. We have with us today Jillian Rifkind. She is an acupuncturist and a body worker. Welcome, Jillian.
Hi.
Hey, so it's so good to have you. I see that you're in Washington and you put a jacket on. So I'm assuming it's getting chilly up there right now.
It is. It's a little misty today.
Oh, that's beautiful. I love that.
Yeah.
So I wanted to chat with you a little bit about, I know you do acupuncturist, which I love as well, but the organ therapy and the body work, I wanted to chat with you a little bit about that, just because my background is in organ donation. So whenever somebody talks about organs, but like it's not taking them out of the body, it interests me. So
and they love to take them out, don't they? Sometimes
they do, and they're very strange when they come out of the body. I don't know. I don't think a lot of people realize what they look like when they come out, and some of them aren't looking very good, especially in society today. So if there's like ways to help while they're inside, I would love to hear about that.
Yeah, absolutely. Well, I study visceral manipulation, and I've been studying that since a couple of years after I graduated my acupuncture program. We actually did a lot of techniques in osteopathic listening, which is using the body from a functional perspective, how the body protects itself going throughout our day and how the body guards itself. And so that points us to specific areas in the body and restrictions, which they could be a fixation in the organs. So for example, like the liver or the stomach could have a little bit of sluggishness that prevents its natural embryological migration, which is the movement that our organs make when we're inside the womb. And so that migration is something that allows blood flow and the healing process to happen. And also breathing is intimately tied with the diaphragm and the movement of the organs. And so I don't know if you're familiar with cranial sacral therapy or if the listeners are, but cranial sacral therapy is a therapy utilizing the flow of cerebral spinal fluid, which runs all the way from the dura mater around the spinal cord, from the cranium, the top of the head, down into the sacrum around the tailbone. And so the practitioner will often make contacts around the spine and around the neck to help to facilitate that flow of cerebral spinal fluid. And that creates a cranial rhythm. And the cranial rhythm moves throughout the body. And so we can feel that rhythm affecting the body all the way down to the bottoms of the feet. And then through the organs, they have a similar migration around both the respiration and then the motility, which is the natural flow of how things move in the body.
Interesting. Okay. I've never heard of that kind of therapy, especially with the CSF fluid. And is there stuff that you can detect while back there?
Definitely. Like if I'm working on the sacrum, I might feel the sacrum is pulled off to one side, or there may be some restrictions in the tailbone, which is very common that you'll take a fall. Skiing or snowboarding is infamous for that. And then your tailbone, it never gets a chance to reset, and you won't be necessarily aware of the fact that there's a restriction there because our brain can only focus on an amount of pain at once, certain areas of pain. And once that it's been going on for a long time, we just sort of block that out, and we're not really aware of that until we start getting treatment for it and we start taking care of it, and then we can start to feel things flow a little bit better.
Yeah, or even probably when you get older and you're realizing there's something wrong back there, and by that time you'll have deterioration of probably some bones, especially if it's neglected for too long, I'm imagining.
Yeah, and it's interesting because I do see a lot of people with back pain. And one interesting thing about the kidneys is that the kidneys move about a half a mile a day through the natural flow of the diaphragm and their movement. And so if you think about how much those parts of your body are supposed to actually move, you'll wonder why we are so uncomfortable when those things aren't moving properly. And also things like NSAIDs, non-steroidal anti-inflammatory drugs, and other methods of dealing with pain relief can be taxing on the kidneys and taxing on the liver. And so if we're creating more stress in organs, that may be creating our physiological pain, why that can't be super helpful.
What do you recommend besides the non-steroidals, like arnica, stuff like that?
Yeah, so arnica is a good topical use. It's also a homeopathic, which some people do well with. It kind of depends. I really like CBD for usage for pain relief. I think that can be helpful for people. But ultimately addressing the root cause of the problem can be really helpful, and that sometimes means taking foods out of your diet that can be inflammatory. So one example might be nightshades. People might be overdoing it on the nightshades. Another example might be oxalates, which can cause joint pain, pelvic pain. Sometimes fibroids or breast cancer can be tied with that flow through the body.
And oxalates, what are those?
Those are found in spinach, kale, almonds, and grains, all the things that people consider are healthy. And also things are high in sugar or vegetable oils can be inflammatory. We want to balance our omega-3s and 6s and 9s in a good ratio so that we don't have a ton of inflammation and fat storage from those omega-6s.
I noticed that when I love cheese, right? But I know
who doesn't?
But when I have too much cheese, I actually, it's gonna sound gross, but I'm phlegmy. I'm not allergic to it, but it makes me phlegmy, like congested.
I'm the same way.
Yeah.
And I actually do well with a little bit of sheep cheese or sheep yogurt, but cow cheese can be, I wonder it's because we're more like a sheep than like a cow. The cows are more phlegmatic, but also dairy and gluten, they both bind to morphine receptors when we consume them. And so it makes sense because when we're drinking mother's milk, we have that attachment to it, that it's supposed to be something that makes us feel good.
Yeah. Oh, interesting. I didn't know that. Okay. I'll try sheep's milk. I don't think I've tried sheep's milk. I've tried goat milk, and that's a very pungent cheese sometimes.
It can be. It depends on the goats and the freshness of it, I think, too. But yeah, I do better with sheep than goat for some reason.
Okay. I'll try that out for sure, because me and my boyfriend love having cheeses, and well, I just tend to be phlegmy because of that. So it's not something I enjoy doing. So, and nightshades, you see that some people have inflammation from those?
Yeah. Some people react to those, and that can cause more pain responses in the body.
What do you think is a good way to look into that? Like, I know for me, maybe they already can associate certain foods with them having like an allergy towards them. Is that similar to like nightshades and oxalates, or is that just something they should just try?
I think it's probably something worth trying yourself and seeing how you feel, and taking a food journal or something and writing down, I felt this way and this is what I ate. Or taking, even with specifically things like gluten and dairy, it is worth taking a little bit longer of a time because it does accumulate in your body. And so it is hard to parse those reactions.
Okay, interesting. So visceral manipulation, I'm interested to see what other organs do you manipulate? Like that's just so different to me, because I'm pretty sure I told you about the liver when in organ donation, what we did in order to see if the patient had enough fluid in them. but what else, what other organs do you guys manipulate?
So sometimes I will work with the lungs, with the
Mm,
pleura, the sacs around the lungs.
yeah.
And that's typical if somebody had whiplash
Mm,
and they took a fall because our bodies aren't 100% symmetrical. The
mm,
liver, as we were talking about before, is actually a pretty massive organ.
yeah.
It takes up, I would say, like 5/6 or 3/4 of the abdominal space. If you looked at a cross section of it,
Mhm.
it is quite a bit larger than the stomach. And so it's not just on the right side, it kind of takes up all the way up to the bottom of the heart and across to the other side. And so when we fall, we have a little bit of whiplash. Things can kind of shift in the body,
Mm.
and that can cause a little bit of restriction in the lungs.
Oh,
I don't work directly with the heart, but I will work with the pericardium ligaments, or the ligaments, which are also known as the thymus gland.
okay.
When we are around adolescent age, our thymus glands turn into a ligament. Also work with plexuses or plexi. The plexus actually corresponds to the different chakras of the body.
Oh,
And
that's a
so
place?
what's that?
That's a place? Like in my body?
Yeah, the nerve plexuses, the
Oh,
places where the nerves braid with each other. I believe plexus means weave.
okay. Interesting. And then,
Yeah, we work with the spleen,
oh,
sometimes with the pancreas, and for women, sometimes the uterus or ovarian ligaments, sometimes with really severe cases of endometriosis and premenstrual pain, there can be a ligament that attaches from the uteral sacral ligament from the uterus to the sacrum. And if that ligament is really tight, it can cause some restrictions in the pelvis and back pain.
mm,
And then there's also a ligament that attaches the large intestine, the cecum, which is the head of the large intestine, to the right ovary. And it only actually exists in a third, I think, of women. But that sometimes explains the digestive reactions that we can have when we're on our menstrual cycle. And it can also create pain in the knee. And so there are, if you think of the organs as they're in this vacuum
mm,
and they're sharing space with each other, the organs in our body have a priority. And so if we have a little fixation or a little issue with the liver, the body would prefer to create some strain on the shoulder than to strain the liver itself. And so often these fixations in the organ systems can relate to musculoskeletal pain and cause some discomfort. One really common thing is a gallbladder could cause some shoulder pain on the left-hand side or some issues with moving the neck around.
interesting. Okay. This is, I guess that does make sense, right? Because the organs are so vital. They're like, we can do without the shoulder a little bit. We can make the shoulder be a little painful.
Exactly.
And then the knee pain with menstruation, um, that's that's crazy. I never would have made that connection at all. So, knee pain. And what are some things that can be done to alleviate that? Is this like a continual thing that they would have to just, um, like if say somebody's coming and they're having like shoulder gallbladder problems, how would that initial visit go? And what like how I know this is question is always different and nobody
Yeah.
really gives like a specific answer because it's different for every patient, but how many sessions does it usually take to get and see results from this kind of
Well,
visceral
I've had people
manipulation?
see results the first time they come in,
Mm,
and it is like, other things that we talk about on this podcast, a preventative thing.
yeah.
And so it can be helpful, but it can also be something that we do for ourselves to maintain our bodies,
Mm,
and to maintain vitality better.
okay.
And so when somebody comes in, I will use a diagnostic exam check the top of the head, and that actually gives my hands an idea of where there's a restriction, because when you just apply a tiny bit of stress to the system will guard something that's already vulnerable. And so I can feel where that might be. And so sometimes that involves a manual adjustment. I shouldn't say the word adjustment because of chiropractors, but manual therapy. And sometimes it's a little bit more subtle and more gentle. It's just just gently supporting those organ systems and allowing them to flow. But I'm usually just listening and using listening techniques to feel where restrictions in the body and what might come next in the list of priorities for the body to work with.
Interesting. Okay. So you can get results the same visit.
Yeah, and often people will feel better, they'll feel a shift, but often it takes a few days for their body to respond to the session fully in the tissues. And then there is a period of a few weeks where the body is shifting subtly. And so often if I know I'm doing a lot of visceral manipulation for a patient, I won't have them come back for 2 or 3 weeks. So they have a little bit of time to reset. And then I have other tools I incorporate in my practice, such as acupuncture and sound healing. And so for those, I might have the person come back a little bit sooner to continue to work with those modalities if they are experiencing levels of pain that we want to address.
Okay. And then you said, before you said acupuncture, you said some other modality. What was that?
Sound healing?
Oh, okay. I love sound healing. I love sound in general. You use what do you use?
Tuning forks?
Oh, you do? I've never used those before. Those look really cool though.
Yeah, it has been really, really fun. We're all made of vibration, and
Yeah.
all of our cells and atoms are vibrating. And so a lot of the information that we store throughout our life through trauma is contained in these vibrations. And so we're able to read these frequencies in our energetic field and find restrictions that we can have, that we can help transmute to allow the body to process those things a little bit better.
Interesting. Okay. I've wanted to talk to somebody about this, and I haven't actually had anybody on. So this is even better.
Awesome.
So for somebody that comes in for sound healing, do they just normally, they know what they're coming in for? And is it usually, this is a redundant question, but I always have to ask it. Is it just like 1 session, 2 sessions, and how often does that occur? Or do you do classes? Because I've seen where they do big classes of that as well.
I just started with using the tuning forks in the beginning of this year. Okay. With things shutting down, I haven't really done anything larger, but that would be really cool. I have some dreams of doing some restorative yoga, sound healing, acupuncture workshops where we could get people in a yoga studio.
Yeah.
So it's often that people don't necessarily come to see me specifically for sound healing. Actually, more so if somebody is seeing me remotely and they're wanting to work with me through Zoom online, then the sound healing is a really great modality and an entryway for them to experience some work.
Okay.
But often the sound healing is something that I just sense and I want to incorporate as part of my work. And so in an ideal session, somebody comes in and I'm able to just work through whatever modalities seem to be helpful. And it really depends. I had somebody recently do sound healing. She's a patient, but she hasn't come to see me since the pandemic. And she said that 1 session made a huge difference for her for trauma. So we did 1 sound healing session, and that really cleared a lot of stuff up for her as far as releasing some old stuff that she had been working on and unearthing. And so that, for some people, I say that, it's more about the person that's coming in than about myself and my work. Some
Mm.
people have amazing innate abilities. We all have amazing innate abilities to heal ourselves.
Yeah.
And some people are more resilient as far as that goes, and they're able to show up and do the work and recover very quickly. And other people may have some more work to do and some more blockages in their life or some more challenges. And so that might be involve a little bit of a longer journey than just one session for those people.
And each session, how long are they usually?
I usually work with people about an hour, sometimes an hour and a half if they
Yeah.
feel like they need a little bit more time.
Oh, wow. Because I've been wanting to go because you see how that before the pandemic, there was events where there was a lot of like sound stuff. I was never able to go. I had a friend that went and she's like loved it. So this
Yeah,
is
like a sound bath.
it. Yeah, yeah. It's exactly that. It's a sound bath.
It's
Um,
interesting. My friend, she went to a sound bath in Joshua Tree,
oh, really?
and I think it was really beautiful and amazing, but after that, she just did not feel right. And she just felt, I think, emotional and maybe a little achy and a little uncomfortable. And this actually led her on this really incredible healing journey with plant medicine and exploring and doing more body work and just finding out what her system needed. But yeah, it's really interesting. I usually tell people when they come in for a session and we do a lot of sound healing work that they should take an Epsom salt bath or soak their feet or do some kind of activity like a sauna to sweat and to move negative energy and toxins out, because sometimes things will come up emotionally for us
Mhm.
that we haven't dealt with. Sometimes, like for example, a lot of times people will have this, especially women, an unexpressed anger that they had since their childhood, and often it could be related to their father and how their father expressed their anger. And so the reaction of that anger expression is, it's not okay to express your anger, I don't want to express my anger. And so after a session doing the sound healing and this area of the anger is can be often around the solar plexus and around the liver and the gallbladder. And even with acupuncture, I've had people say they all of a sudden had this outburst and they never have an outburst. And so they're realizing that they're opening up these pathways that may have been blocked.
Oh, wow. Okay. Hmm. Interesting. Because I feel like a lot of women are, that's like such a common theme, unfortunately. Women are not supposed to do that stuff. And then the women that do that stuff usually are labeled um, in a negative fashion. But men that do
Often
that,
we see a lot of breast cancer and a lot of, uh, you know, digestive issues and restrictions in that area from people holding and not able to just let that energy flow off of them.
yeah, I can't wait to see how things are in the um, next 50 years. Because I think right now we're going through a time of big change, of course,
Yeah,
on all facets. Like everyone's not just looking at Western medicine as the hero anymore. They're looking at other alternatives. So to see that combined completely in the next 50 years, I'm interested to see what we as a society look like because I know what we look like as a society now versus what we should look like. Like organ wise, we look like crap. We look like crap. Despite all these advances we have, we're still not treating ourselves for the vast majority. The poor population, like they're not going to have access to a lot of the holistic alternatives we're discussing right now, not for a while, because most of these things are out of pocket. Insurance doesn't cover it.
yeah. Well, Medicare is starting to cover acupuncture, which is really nice.
Oh, and chiropractor too, right?
And I believe physical therapy and maybe possibly chiropractic too.
Yeah.
Um, the VA, the Veterans Association, they cover acupuncture. So I do have some vet clients that can come in, which is really wonderful because sometimes PTSD and things like that, they require a gentler form of therapy than just medications that we can support them on.
That's great. I love that. And I think like more people opening up to that, because I feel like acupuncture and chiropractor people are just warming up to that a lot of the times right now, especially if you're not on the coast or on the East Coast or West Coast, especially like maybe like the central mid-America. They're not used to that kind of stuff. So I love having this information out there just so people can go to an acupuncturist, go to a chiropractor. I spoke to some guest. I want to say it was a chiropractor. And they said that a few years ago, like 20 years ago, there was some kind of smear campaign by some other physicians to make it that everyone like was afraid of chiropractors. Like they're the ones that started the smear campaign that if you go to a chiropractor, you get your neck broken, all that. And that was done intentionally by another, gosh, I'm going to have to look that up. But she told me, I want to say, yeah, they told me that was done intentionally by another physician's like branch. You know what I mean? Like probably like a general, a PCP or something like that.
Yeah. I mean, there are a few isolated cases of malpractice.
Yeah.
And things like that where people do unfortunately like lose their lives because of a bad adjustment. But it's like any practice.
Yeah.
An acupuncturist, a physical therapy, if they are putting their hands on you, you want to go to somebody that you trust and that has really good rapport.
Yeah.
And that's why, word of mouth from friends and family is one of the most significant tools that you can have for finding the right person for you.
Yes, definitely. And that goes for any kind of healthcare practitioner, because I've worked with so many through the years and so many. And a lot of them have really good personalities, so it covers up their neglect. I've encountered that, unfortunately, with surgeons I've worked with, like really advanced surgeons. But what happens with that is their ego gets better than their skill. And so their ego is huge and they want that to be. There was a surgeon I worked with. He liked to be called Hyperion. Do you know who Hyperion is?
No.
He's the father of all gods.
Uh-huh.
That was literally how he saw himself.
That's crazy.
So, and he had a great personality and people loved like talking to him.
Yeah.
But what they didn't see is like just how he didn't pay attention to their complaints. He would throw away their messages, like he would ignore them. And he never took the fault for that, unfortunately. So
I would say find somebody that spends time with you.
Yeah, he
Our
spent time with them.
is major currency.
Yeah.
And to have time for your patients and to be interested and to be looking at research and really fully interested in what is going on with their condition.
Yeah.
I think is really important because some, any therapist or surgeon or if you're only spending 5 minutes with a patient, how are you supposed to know about, how are you supposed to listen to their body and feel what needs to happen?
Yeah, exactly. So, but all right. So so all of this is new to me, like what we were talking about, from the sound to the body work, the visceral manipulation, totally new to me. Is there anything I didn't ask you that I didn't know I should ask you that you want to say?
I don't think so. I think you kind of covered a wide variety of different complaints and different things that can manifest themselves in the body. I would say that often we have these, as we talked about a little bit, we have these emotions in our body and these emotional blockages. And I do think it was some statistic that 90% of ER visits are actually related to emotional stress. And so looking inward and listening to our body and finding the things to balance and harmonize can be really important. And I know that sometimes people They have a lot of pain and it's difficult, and they want to know what herb, what drug, what supplement they can take, or they want, you know, a shot or a surgery because it's a quick fix. But this problem that you have, it's going to keep coming back unless you address the underlying issue below that and provide a little bit of care and listening to your system.
Yeah, definitely. To get off all the medication that's so easily prescribed right now to put a Band-Aid on issues that'll only get worse in time. And then how about this? I like asking some fun questions at the end. So is there any good books that you're reading right now? Do you recommend?
Yeah, so I'm reading the bestseller by James Nestor about breath.
Oh.
And he actually, interesting, he discusses mouth taping and how it can cure things like sleep apnea and snoring.
What?
And
tell me that again. What kind of taping?
Mouth taping. So when at nighttime, you take a little tiny piece of like paper tape, and to make it a little easier, you can put a little bit of olive oil or coconut oil on your lips so it doesn't get too sticky. And you put it over your mouth, and it encourages you to breathe through your nose, because so many indigenous cultures have been breathing through their nose for thousands of years. And that has actually changed the shape of their sinuses and the shape of their face. And also the microbiome, which starts in the mouth and goes through the gut. It can be disrupted if you're opening your mouth at night. And so I've been experimenting with a mouth taping, and it is actually strangely soothing, like kind of like being a mummy in your little cocoon. And it encourages me to breathe through my nose, which I think is really helping me with when I get anxious. I don't gulp for air. I have this just steadiness of breathing through the nose and breathing deeply. And that is something that actually he did an experiment where him and his colleague, they had their noses implanted temporarily with silicone plugs for 2 weeks and measured all their vital signs, and then recovered from that, took those out and remeasured all their vital signs and all the different things, measures of blood pressure and hypertension, and a lot of things improved from doing that. So he has some interesting ideas about breathing through one side of the nostril, and how we and how the nose actually is the same tissue as the erectile tissue or the perineal tissue. So when we're in the womb, we're in this embryological shape, and our brain is actually where our small intestine is. So that's why they call the small intestine the second brain. And our ears are actually where the kidney is. And so all of that is connected. And that's actually where a lot of the principles of acupuncture come from, is treating similar parts of the body to have an effect on other parts of the body.
Interesting. Okay, I like that book. And the whole snoring thing, that sounds like a fun experiment to do one night.
Yeah.
Nice tape to put on your mouth. I might do that with my boyfriend. We'll see what happens.
Maybe let him know first.
No, I'll let him know, but I'm not just going to be like, that would be funny though. Okay. And then lastly, what's your favorite breakfast?
So I've been making a duck patty with, I use liver and heart, and I'll just, chop up really fine or slice really fine pieces of liver and heart into the duck patty, and put some herbs like thyme and rosemary and oregano in the duck patty. And then I'll put a poached egg on top. And then occasionally a little gluten-free toast, or a little arugula, or a little bit of roasted acorn squash.
Where do you get a duck patty? Okay, so I've had duck and I loved it, but I've never heard somebody just do a duck patty.
Just ground duck. You could use ground chicken. You could use ground pork. You could use ground beef.
Oh, you just like duck. I like duck because it's dark meat, so I'm partial to
It's
dark.
a little fattier than chicken. It's got a little bit of flavor to it.
Yeah, okay. And how's the liver and heart in there?
You just don't taste it. That's, my hack is just to cut it up really small. And so you're not really feeling like you're getting a bunch of organ taste when you eat it. And
Hmm.
the other morning I fried up a heart and a piece of liver, and it was a little strong, but it was good.
Oh, okay. And you just get that from your local butcher?
Yeah, I get it from there's a local farm store in town, and they have a lot of different options for meats.
Oh, okay.
I keep the liver and the heart frozen.
Mm. And so you chop it up.
I got a
Frozen.
whole cow heart from a farm around here.
Oh, how big was that? This big?
It's enormous. It's pretty big.
Oh, so that could last a while.
Yes, it will.
Oh, wow. Okay. I'll look into that. My boyfriend is a big meat eater, so we're compromising for sure on what we eat.
Yeah. And that's great. I've been listening to podcasts from Paul Saladino, who
Okay.
treats a lot of autoimmune illnesses with the carnivore diet. And
Oh.
the premise is that there's a lot of toxins in plants. We kind
Mm.
of discussed oxalates before,
Yeah.
but then there's things that are harmful to your thyroid, like goitrogens and other things that are they have a lot of fiber. And
Mm.
so people with autoimmune issues, they can respond to these plants. And so take everything with a grain of salt.
Yeah.
I find like a few plants that are not super harmful for me
Yeah.
and just kind of work with it based on what my particular health journey at the time is telling me what to do.
Yeah.
But I do think that meat gets such a bad rap, but it is
Yeah.
actually really healing and really nourishing to our gut.
You're like the first person I'm positive that I haven't talked to somebody that was a vegan yet. None of the practitioners I've talked, none of them have been totally like solid one way because they're in a realm or a sector where they see there's all these benefits and you take a little bit from each and you kind of just make it your own. But you're the
Yeah.
first person that I've talked to that was like, yeah, I have had duck patty. So that is refreshing. It's different. I'm kind of being more open to eating meat than I used to, and he's being more open to eating more vegetables than he used to. So
Awesome. Were you a vegetarian or a vegan?
no, I was never a vegan. I wasn't a vegetarian. Well, I kind of just didn't eat like a ton of meat, and I didn't eat pork, and I didn't eat beef.
Mhm.
It was mostly like fish and chicken, and just a lot of vegetables. So we've compromised, and I have beef twice a month now, and he
That's,
goes
that's good.
vegetarian once a month. So
I recovered from being a vegetarian while I was in acupuncture school.
oh really?
Yeah,
What
and I
was
found
that
out
kind
that when we use our brain, we use a lot of glucose and we use a lot of blood
of?
and a
Mm,
lot of intention. And that sometimes requires these minerals, and not necessarily just iron, but all the minerals that are in red meat specifically can
mm,
help to fuel that. And so when I started school, I realized, oh, now I'm learning about health, I'm realizing that I'm not very healthy in this state. And I was always falling asleep in classes and
yeah.
lacking in that vitality. And so I do think that I really bounced back from just incorporating some meat into my diet and just taking care of that.
Yeah, definitely. I'm fine with it. Like I had initially I hadn't been eating beef for such a long time that when I first had it, my stomach was not happy about it for sure. But it's just like the microbiome like in there was not used to having to digest beef. So, but now it's the twice a month that I'm gotten used to it. So it works out good. I'm happy. He's
Yeah.
happy. So
And a
that's
large
good.
percentage of Americans are deficient in hydrochloric acid,
Mm.
partially because we don't digest our food. We don't take time to go into a parasympathetic mode and salivate. And so that can be a huge problem. But on the flip side of that, living closer to the equator, you probably don't need as much animal protein as you would living in the Pacific Northwest.
Oh, are you talking about, the weather?
Because you can absorb more
Heat.
foods that are growing locally in season.
Yeah, our farmers market. But you guys have good farmers markets too, right?
Yeah, absolutely, we do. But it's just a different. There's different nutrients that you absorb better when you have more sunshine.
So you can take vitamin D pills?
I take cod liver oil
What is it?
and cod liver oil,
Oh,
which is
okay.
a Norwegian. It's something that they use.
And that has vitamin D in it?
Vitamin D and vitamin A.
Okay.
But yeah, it just shifts the amount of fish that's needed is increased, I think, in northern climates.
Mm, that makes sense. Okay. All right. Well, this has been good. I love it. You know what? I got a lot of information that I wasn't like the sound healing, wasn't anticipating that. I love that part. I didn't really think sound healing would take an hour and a half at all. But that's just with one person?
Usually a 90-minute session, I incorporate quite a few modalities. So there might be some massage, acupuncture,
Okay.
visceral work. Usually the sound healing, we could spend maybe 40 minutes on it, but yeah,
Okay.
it's not usually something that I spend that long with.
Okay. All right. Perfect. Well, thank you so much for being on. I appreciate it.
Absolutely, it's a pleasure.